treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice-pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily.
Welcome to this calm, peaceful moment. Take a deep breath in and gently release it. Today we're going to explore two different approaches to exfoliation, physical and chemical. Both can be effective, but they work in very different ways. Understanding these differences will help you choose the method that's right for your skin, your lifestyle, and your goals. There's no single correct answer, only what works best for you. Let's begin by understanding what exfoliation is at its core. Exfoliation is the process of removing dead skin cells from the surface of your skin. Your skin naturally sheds these cells continuously, but sometimes they accumulate, leading to dullness, rough texture, and clogged pores. Exfoliation helps accelerate this shedding process, revealing fresher, brighter skin underneath. The key difference between physical and chemical exfoliation is how they accomplish this goal. Physical exfoliation uses manual friction, scrubbing, rubbing, or abrading to physically remove dead cells. Think of it like using sandpaper to smooth wood. You're mechanically buffing away the rough outer layer. Chemical exfoliation uses acids or enzymes to dissolve the bonds holding dead cells to your skin. Think of it like using a solvent that loosens glue. The cells can then shed naturally without scrubbing. Let's explore physical exfoliation first. Physical exfoliants come in many forms: scrubs with granular particles, sugar, salt, jojoba beads, coffee grounds, cleansing brushes, konjac sponges, washcloths, exfoliating gloves, and microdermabrasion tools. The main advantage of physical exfoliation is immediate gratification. You can feel it working right away. Your skin feels noticeably smoother instantly. There's something satisfying about that immediate textural change. Physical exfoliation is also straightforward to use. You don't need to understand pH levels or wait times. You simply scrub and rinse. The simplicity appeals to many people. Some physical exfoliants provide gentle, effective exfoliation. Konjac sponges, for example, are incredibly gentle and perfect for sensitive skin. Fine, round jojoba beads provide smooth exfoliation without harsh abrasion. These gentler options can be excellent choices. However, physical exfoliation has significant drawbacks that you need to understand. First, it's easy to over-exfoliate with physical methods. That clean, smooth feeling can be addictive, leading people to scrub too hard or too frequently. Over-scrubbing damages your skin barrier, causes micro tears, and leads to irritation, redness, and sensitivity. Second, many physical exfoliants are too harsh. Scrubs with irregular, sharp particles, like walnut shells, apricot kernels, or salt crystals, can create micro tears in your skin. These tiny injuries compromise your barrier, allow bacteria to enter, and can lead to inflammation and infection. Third, physical exfoliation is uneven. You apply more pressure to some areas than others. You might over-scrub your cheeks while under-scrubbing your forehead. This inconsistency can lead to uneven results. Fourth, physical exfoliation isn't ideal for sensitive, acne-prone, or rosacea-prone skin. The friction and pressure can aggravate these conditions, causing more inflammation and problems. Fifth, physical exfoliation only works on the surface. It cannot penetrate pores, so if your main concern is clogged pores or blackheads, physical exfoliation won't be very effective. Now let's explore chemical exfoliation. Chemical exfoliants include AHAs, alpha hydroxy acids like glycolic and lactic acid, BHAs, beta hydroxy acids like salicylic acid, and enzymes like papain from papaya and bromelain from pineapple. The main advantage of chemical exfoliation is controlled, even results. When you apply a chemical exfoliant, it works uniformly across your entire face. Every area gets the same level of treatment. This consistency produces more, even predictable results. Chemical exfoliation is gentler on your skin barrier. There's no physical friction or scrubbing, so you're not creating micro tears or damaging your skin through mechanical force. The acids simply dissolve the bonds between cells, allowing them to shed naturally. Chemical exfoliants can penetrate pores. BHAs, especially being oil-soluble, can work inside your pores to clear clogs from within. This makes them far superior to physical exfoliation for treating blackheads, whiteheads, and acne. Chemical exfoliation offers additional benefits beyond just removing dead cells. AHAs increase hydration, stimulate collagen production, and fade hyperpigmentation. BHAs have anti-inflammatory properties. These bonus benefits add therapeutic value. Chemical exfoliation is customizable. You can choose different acids, concentrations, and frequencies to match your specific needs and tolerance level. You have much more control over the intensity and effects. However, chemical exfoliation also has challenges. First, there's a learning curve. You need to understand different acid types, proper concentrations, pH requirements, and how to safely incorporate them into your routine. This takes research and patience. Second, chemical exfoliants require sun protection. AHAs increase sun sensitivity by removing that protective layer of dead cells. You must be diligent about sunscreen when using chemical exfoliants. Third, initial purging can occur, especially with BHAs. Existing clogs may surface more quickly, causing temporary breakouts before your skin clears. This can be discouraging if you don't understand it's a normal part of the process. Fourth, chemical exfoliants take longer to show results. While physical exfoliation provides instant smoothness, chemical exfoliation's deeper, more significant improvements take weeks of consistent use to become visible. Fifth, chemical exfoliants can cause irritation if used incorrectly. Starting with too high a concentration, using them too frequently, or combining them with other strong actives can damage your skin barrier. So how do you choose between physical and chemical exfoliation? Consider your skin type first. If you have sensitive, reactive, or acne-prone skin, chemical exfoliation is generally better. The gentle, controlled nature works better for delicate skin. If you have resilient, normal skin, either method can work, though chemical is still typically gentler. Consider your skin concerns. For dullness and rough texture, either method works. For hyperpigmentation and fine lines, chemical exfoliation, specifically AHAs, is more effective. For clogged pores and acne, chemical exfoliation, specifically BHAs, is far superior. Consider your lifestyle. If you're bad about sunscreen, chemical exfoliation isn't ideal for you. It increases sun sensitivity too much. If you want something simple that works immediately, gentle physical exfoliation might suit you better. If you're willing to invest time in learning and being consistent, chemical exfoliation often produces better long-term results. Consider your preferences. Some people love the ritual and tactile satisfaction of scrubbing. Others prefer the hands-off simplicity of applying a toner or serum. Honor your preferences. The best routine is one you'll actually follow. Can you use both methods? Yes, but carefully. Some people use gentle physical exfoliation once a week and chemical exfoliation 2 to 3 times a week. However, this increases the risk of over-exfoliation. If you combine both, start conservatively and monitor your skin closely. If you choose physical exfoliation, follow these guidelines. Choose gentle exfoliants with smooth, round particles. Avoid harsh scrubs with irregular, sharp particles. Konjac sponges, jojoba beads, and fine rice powder are good options. Use light pressure. You should never scrub vigorously. Gentle circular motions with barely any pressure are sufficient. Limit frequency. Once or twice a week is plenty for most people. Daily physical exfoliation is almost always too much. Avoid scrubbing active acne, inflamed areas, or open skin. Never scrub if your skin is sunburned, windburned, or otherwise compromised. Follow with hydrating, soothing products to support your barrier after exfoliation. If you choose chemical exfoliation, follow these guidelines. Start with low concentrations and build up slowly. Patience is crucial. Use acids on clean, dry skin for best results. Always follow acids with moisturizer to support your barrier. Use sunscreen diligently every morning. Monitor your skin for signs of overexfoliation, redness, burning, excessive sensitivity, or shiny, tight skin. Don't combine multiple strong actives without understanding how they interact. The ultimate truth? For most people, properly used chemical exfoliation produces better, longer-lasting results with less risk of damage than physical exfoliation. However, very gentle physical exfoliation used occasionally, carefully, can be a pleasant addition to a routine. The worst approach is aggressive physical exfoliation, harsh scrubs used frequently with vigorous pressure. This damages skin far more than it helps. As we close, remember that exfoliation is just one tool in your skincare toolkit. It's not mandatory. If your skin is healthy, comfortable, and you're happy with it, you don't need to exfoliate at all. Your skin will shed cells naturally, but if you want brighter, smoother skin, proper exfoliation can help. Choose the method that fits your skin, your concerns, and your lifestyle. Use it wisely, gently, and consistently. Take a deep breath in and release it slowly. Trust yourself to make the right choice for your unique skin. May you find the exfoliation method that serves you best. May you use it with wisdom and gentleness.
Kêu cho Long á, cho hai chị của chị là vô cái phòng nhỏ á, rửa mặt giùm chị đi. Chị làm xong chị qua. Ráng xíu rồi, ráng xíu. Chịu khó xíu cho hết mụn nha. Dằn mình tới bên đây không chưa? Bên đây nó nhiều. Cục nào mấy bự bự không nè, ráng tí. Cố gắng lên tí không? Mụn quá trời nè. Bên này, bên này nhiều hơn bên kia. Không thôi nó nát hết cái mặt này. Cô lấy cẩn thận nhẹ nhàng lắm rồi đấy. Con ráng xíu ha. Rồi cô cho nghỉ nha. Ráng xíu nữa con. Cục này hơi cứng nè. Rồi, ra rồi nè. Nó cứ ngắt để lâu dưới đây quá nè.
Nó nặng rồi nè, chừng nữa lấy cái điếp đưa qua máy con nữa con về.
Tết có mẹ con có về quê không?
Có.
Để xíu con nha. Để xíu. Rồi ra rồi nè. Đó. Mẹ thấy không? Ngắt mà bự nữa.
Bên tay máu nó chảy xuống cái cằm.
Rồi để cô ơi chậm. Con nằm yên nha. Rồi đừng nhúc nhích. Mà con có hút thuốc hay là uống rượu bia gì không?
Dạ không. Rượu bia thì thỉnh thoảng.
Ừ. Rồi. Thì ăn uống kỹ vô tí. Tuổi này nó đang dậy thì những cái ổ viêm á dạ. Chị được mấy bé?
2. Thằng này nhỏ với nhỏ chị.
À.
Chị nó học ở bên trường Hữu Tết.
Học Hữu Tết nghe nó học phí mắc lắm hả chị?
Ừ.
Duy mà mũ trơn nè. Đó. Hơi nhẹ qua đây rồi chị. Để lâu nó lan ra.
Cho xăm gì chị? Em chỉ làm luôn cho xăm thôi.
Đi sát vào đây. Nãy em nói người ta nhiều quá người ta. Nghỉ. Nghỉ. Cố lên nghỉ nha.
Dạ.
Em chịu tốt à. Nó rút ngắn thời gian đi. Chị cố gắng làm kỹ nhất có thể. Dưới đây nó quá trời luôn rồi em ơi. Chịu khó chút nha.
Dạ.
Dưới đây em lo trẻ mai mốt bị sợ lòi á. Cục bự bự á. Dưới cổ à.
không.
Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54, Drug-Induced Acne and Medication Side Effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible or combining lithium with aggressive acne treatment might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation. The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone.
Thuốc, chị cho thuốc về uống. Với lại những cái đèn qua đây xíu.
Thứ mấy một ngày mấy một tuần, thứ mấy một đây bộ.
Ngày 4 tháng 8.
4 tháng 8 rồi. 1 2 3 4.
Mấy dụng cụ
5 tuần luôn á. Là bữa nay là 17 rồi.
Mấy dụng cụ mà chị làm là dùng riêng hết cho từng khách nha.
Dạ.
Dùng một lần mình bỏ nên em yên tâm nha. Rồi quá trời luôn nè. Chịu được không em?
Dạ được.
Chịu được. Cố gắng một xíu cho hết mụn ha. Chứ không cái mặt em nó rỗ hết. Hai chị em là ở quận mấy hả em?
Em ở Thủ Đức á chị.
Thủ Đức à?
Dạ.
Ừ.
Chị em quay được không?
Được.
Trong...
Để lát chị gửi cho.
À dạ ok chị.
Lát chị gửi qua cho.
Cái này mà không lấy thì sức kiểu gì nó cũng không hết nổi.
Đúng rồi, nó nhiều quá rồi nè. Dày luôn á. Mấy cái sản phẩm bôi nó chỉ hỗ trợ thôi chứ nó không tiêu được cục mụn này đâu em ạ. Ví dụ như nó hỗ trợ gom nhân mụn này, nó hỗ trợ để làm mềm da nè, nó hỗ trợ để nhanh lành thôi. Chứ còn bôi cục mụn bự cứng vậy sao mà nó ấy được.
Bây giờ sau này là phải giữ da cho sạch đúng không chị?
Ừ. Tại cậu này hay hoạt động ngoài trời.
Đúng rồi.
Với mùa hè này nè, mùa hè thì mồ hôi. Mới có một xíu da chỗ này thôi mà nhiêu đây rồi.
Mẹ nói là cũng không có hay cậy hay đồ á chị.
Ừ. Có sao để nguyên vậy đúng không?
Nó cũng sợ chứ không, chứ nghĩ là nó khó chịu lắm.
Để lâu nó bị viêm lên nè, mấy nốt này là viêm rồi nè. Nhìn cục mụn bự không à. Cố gắng lên nha.
Không sao.
Cố gắng lên. Lên chị mau hết. Này mà đi trễ cái nữa, thời gian nữa là nó bị viêm hết mặt luôn á.